What's up, friends? Rob Sevilla here. Some know me as the Medicare Minister with Agape Insurance and Financial Group in Tupelo, Mississippi. And I don't want you to sign up for a Medicare Advantage plan or Part C plan until you watch this video, because I'm going to give you some really important things that you need to know about when it comes to getting signed up with one of these plans. And so I want to just right out of the gate say this. I personally do not think Medicare Advantage plans or Part C plans are bad if you know what you're signing up for. And there are many clients that we talk to and work with that this is really the only plan that they can afford in their budget. Now, if you've seen these commercials on TV that, tell you there's zero premium plans, they're going to give you all these extra benefits and they're going to throw the whole kitchen sink at you, if you will, and it sounds really, really good. Well, there are some things that you need to be aware of because they can be good plans, and that's just surface level stuff. But there are some nuances, some caveats that you need to be aware of. And I'm going to take the next few minutes and go through all of those with you. Now, here on the screen, there is a tool that we use that allows us, no matter what zip code we are trying to help someone in, it allows us to put that zip code in. I'm going to use 38801 because that's where I live here in North Mississippi. And it's going to pull up all the Medicare Advantage plans that are available in my particular area. Okay, so that's what I have here on the screen. Is I'm looking at all the Part C plans. There's three major companies in the area, that are available in the area where I live. Number one is Aetna, number two is Humana, and number three is United Healthcare. I'm going to take out Humana for this particular purpose, not because they're a bad company, but simply because where I live here in North Mississippi, they do not have a very robust network. They don't have a lot of providers that are on the network currently in 2023, where I know that Aetna and United Healthcare do. So I'm going to just kind of compare these two today, give you some ins and outs of these particular plans and just Medicare Advantage Part C plans in general. So make sure you get a pen and paper ready or make some notes in your iPhone or one of your smart devices, or maybe you're watching this on a laptop, because you're going to want to know some of these things, especially if you have seen the commercials or you're getting some kind of text messages or phone calls or emails. And if you're turning 65 or if you're new to Medicare or on disability Medicare. So you're going to hear a lot about these plans, and you just need to make sure that you know if this could be a good fit for you, or if it's better for you to go the original Medicare route with a Medicare supplement, drug plan, and any other ancillary plans that you may need. So a couple of things today, right out of the gate, that I want you to be aware of is, number one is there's a difference between a PPO, you see me highlighting it here on my screen, and an HMO. To keep it real simple, the main difference is a PPO allows you to go in and out of network. You just pay a little bit higher copay if you go out of network, where an HMO restricts you in the network, which means I can't go outside of the network or I'm going to pay full price. Why do I bring this up? Because you want to have whoever you're working with, and we would be more than happy to review this for you. But if you have someone that you're already working with or someone that you're leaning towards working with, that's fine. They just need to you need to make sure that they are checking that your doctors are in the network. That is very, very important, because you don't want to get stuck on a plan where you can't go see your regular doctor. Or give you an example, and this happens quite frequently, maybe a new medical situation happens in your life and you're referred to a specialist or another doctor. And so it's very, very important that you're on a PPO plan. So that way, if that happens and they're not in whatever company's plan network, you will still be able to go to them and just pay a little bit higher situation. So that is very, very important. The other thing that I want you to be aware of is you need to make sure that they are checking your medicines. Your medicines are very, very important in the pharmacy that you visit or that you currently go to, because you could pay a higher price for your medications altogether, because there's a difference between a preferred pharmacy, which is your lowest price, okay, versus a standard pharmacy, which is a little bit higher than your preferred. And then also what you want to be aware of is that they are going to cover those drugs. There are some plans that don't have certain drugs in their formulary. And this is why you want a Medicare advisor to help you sort through all this. So that way you don't get stuck on a plan that doesn't work with your doctors or local hospitals, as well as not cover your particular medications, because some of these medications can be hundreds, even thousands of dollars full price. And so that's why we use a tool like this, because it allows us to do that. If I want to go over here and let's say you're on blood pressure today and medicine like lisinopril, which is a real popular one, I can add that medication. Let's say you use Walmart. I can save that here in my tool. And then I can go under this particular plan, which is the AARP plan, and I can go under drug cost details. And it tells me that Walmart under this plan is a standard retail. So that means I'm going to pay a little bit more than I would for a preferred. But in this case, because it's a low tier drug, it's not going to cost me it's not going to cost me anything at all. Okay. So this is very important when you're looking at shopping or getting signed up for a Medicare Advantage or Part C plan. Okay, so PPO versus HMO. The other thing that we want to be aware of, and I'm going to look here now under the Aetna plan. I'll tell you what, let me compare two plans here for you, and let's take a look. And so we're going to look at both of these plans that are PPO plans. One has a 4-star rating, one has a 3.5-star rating. This another important thing we want to look at is a max out of pocket. A max out of pocket just simply is the most that I could ever pay out of pocket in one calendar year. So the AARP is a little bit higher than the Aetna, but this is very important to look at because there are some that have higher max out of pockets than this, and you need to be aware of it when it comes to getting signed up for a Medicare Advantage plan. If I go out of network, it says that my max out of network or combined maximum out of network, if I go in and out of network, is $10,000. So it shoots up a little bit, and it goes from $5,900 on the Aetna plan to $8,950. They don't have a drug deductible. That's another big thing to worry about, because if you're on a standalone drug plan, almost all the lower premium ones have, or all the lower premium ones have, a $505 deductible, where you can get on a no deductible drug plan, a separate drug plan, if you're staying on original Medicare, that is, where some of those run you about $60 to $100 plus per year. Okay, so these are things that you want to be aware of, like what kind of drug deductible am I going to have to pay? And then we'll go down here and look here. I'm not going to go through every single thing, because this is something that you can sit down with a Medicare advisor and go through all this in more detail. Once again, we're more than happy to help you with that. Our phone number is in the video description, and you're more than welcome to give us a call. But you want to look at a lot of these things. So one in particular here is ambulance. An ambulance ride has a copay. The Aetna's is $295. It looks like here United Healthcare's is $250. So that's a big deal. If I take an ambulance ride to the hospital today on this particular plan, even though it's costing me $0, which pretty much most of them are $0 premium plans when it comes to the Medicare Advantage or Part C, you want to take into consideration that even though it's costing me nothing, now I have a copay associated with this ambulance ride. Okay, so it's $295 in network and out of network. Same thing here, $250 in network, $250 out of network. They have chiropractic services here, $20 in network, $55 out of network. One of the big reasons that these plans are so popular is because they give you dental, a dental benefit at no cost to you. So in that $0 premium Medicare Advantage plan, in most cases, you're going to get dental, vision, hearing, and generally an over-the-counter card that you can use for supplements and wellness products. The AARP plan gives us $1,000, right? Where Aetna gives us $2,200. So let me stop here for a second. This is another important factor that you want to take a look at. Why are you wanting to get on one of these plans? What is one of the benefits that really attracted you to this plan? If it's dental, then you definitely want to go the Aetna route because they're going to give you $2,200 a year for dental. So if you have some impending dental needs, some urgent dental needs, this is a really big deal. Okay. Diabetic supplies. Looks like here, if I go get diabetic supplies, it says co-payment for Medicare covered diabetic supplies is $0. My co-insurance for any kind of therapeutic shoes or inserts is 20%. So pretty much the same thing over here on the Aetna as well. And you have your diagnostic tests, lab, radiology services, x-rays. And so these are all things that you want to know about. What kind of co-pays am I going to have for a diagnostic test, or if they take blood or an MRI or a CT scan, and so on and so forth. Okay, doctor visits. This is a big one. Okay, most of the time they're going to be $0 if you go in the network. AARP says theirs is $20 to $55 out of network. Aetna says that theirs is $20 out of network. If I go to a specialist in network, it looks like both of these plans have a $35 in network copay. That means every time I go to an ologist, a cardiologist, a pulmonologist, a rheumatologist, an oncologist, I always tell people if it has an ologist at the end of it, you pretty much know you're going to a specialist, but it's $35 in network. It's $50 on the Aetna side and $55 out of network on the AARP side. Durable medical equipment, that's a big deal to many people that we talk to. That's your wheelchairs. That is your nebulizers. That is your CPAPs or BiPAPs or walkers. So you have to know that you're going to pay a 20% copay on that in network and 20 to 50% out of network on the AARP and 30% out of network on the Aetna. Now, let me pause here for a minute. I'm using these two as an example. This is why you want to work with the Medicare advisor, because you want to be able to have a tool like this, you want them to have a tool like this where they can check all this out for you and see what plans are available in your particular area. Okay. So durable medical equipment is a huge concern for many of our clients. You want to make sure that they're covered well. And then the other thing is that durable medical equipment company has to be in network with these particular plans. Okay. Emergency care. Hearing services. This can be a big deal to some people here. $175 to $1,225 copayment for hearing aids, maximum 2 hearing aids per year. Well, if hearing was a huge benefit for you, you may not want to look at the Aetna plan because they're only going to give you $500 per year to use for hearing. Home health care. I mean, I can go on and on and on. I'm not going to spend a lot more time on this. I'm just kind of wanting to show you and give you an example that if you're a Medicare beneficiary today, you need to be aware of all these things before you just go jump into a Medicare Advantage plan. Outpatient, that is a big deal. There's many of our clients and Medicare beneficiaries are having to go to outpatient services. So you want to know what the copay is there. Most of these Medicare Advantage Part C plans are going to give you some type of over-the-counter card. In this particular case, these two plans are giving you $60 every quarter that you can use for like fish oil or vitamin C and other type of supplements and health and wellness products. Okay. Podiatry services. That's a big need for some people. Prosthetic devices. I'm going to just skip down here real quickly. Vision services. If vision is a really big need that you have, you need to look at what are they going to cover on vision. United Healthcare is given $200 extra allowance per year, and it looks like Aetna is giving you, basically they're going to give you a copayment for Medicare cover benefits from $0 to $35. You get a routine eye exam. So it gives you, here it is, $300 every year. So if vision's a really big deal to you, then you may want to take a look at the Aetna plan. You really want to find out what's the benefits that you're going to benefit from the most when you get on these plans. And once again, to recap, you definitely want to make sure your doctors or hospitals are in the network, as well as your pharmacy for your medications. And this is a big one that I want to stop here real quickly. And that is this. This is where some people get shocked when they get on a Medicare Advantage plan and they have to go to an inpatient or they have an inpatient stay, is because right here in the fine print, it says $295 for days 1 through 7. And that's on both plans here. I'm reading the fine print. $0 for days 80 to 90. So in other words, those first 7 days in the hospital, let's just round it up to $300 per day, is your responsibility. Now, the good news is you can put a little gap plan in place to help shield you against that. But if all you had was this particular plan, this Medicare Advantage Part C plan by itself, you're going to be responsible for that $295 per day. This is what the commercials don't tell you. They'll tell you zero premium. They'll tell you dental, vision, hearing, over-the-counter card, and more. But this is the stuff that you really need to be worried about and concerned about when it comes to going inpatient in the hospital. And then your drug coverage, finally, there is no drug deductible, which is a really big deal. Most people are going to be on tier 1, tier 2 drugs. Those will be like metformin for diabetes, lisinopril for blood pressure, some type of statin like an atorvastatin for cholesterol, omeprazole maybe for some stomach issues. So most people are going to be on generic stuff, tier 1, tier 2. And so you don't really have to worry about breaking the bank there. But the reason you want to review your medications is because you want to take a look here is that when I start getting up to tier 3, I still don't have any kind of deductible or anything, but now it's a little bit more. It's $47 on both plans. If I get on a tier 4, that's $100. All right. And if I get on a tier 5, you just have to take a look at it here and see what the copay is, or the percentage is your part. So these are things that you want to really review when it comes to getting on a Part C plan. Now, here's another thing that I want you to take a look at real quickly, or to think about, is if there is a possibility of going into a nursing home down the road. And I know no one ever knows, and that's not anybody's first option to go to a nursing home. You have to be aware that a lot of these Medicare Advantage plans and Part C plans, for lack of better words, just don't play nice with nursing homes. And so you want to take a look at that if you have to go in the nursing home, whether that's a short-term stay, or you may be in there just for a little bit longer, an extended stay, for maybe you've fallen and broken your hip, or you break your leg, or you hit your head, or you have to go for some type of rehab in a nursing home where they can watch you 24/7. You need to be aware of those type of things when you get on these particular plans. Okay, so I'm going to stop the video there today because I don't want to overwhelm if you're watching this, but this is just a short Medicare Advantage review and outline that I wanted you to be aware of. I'll finish by saying this, that when you look at these particular plans, you do want to look at star ratings. That's important, and definitely want to do that. But most important, in my opinion, is you just want to make sure that it will work with your providers. Especially if you're going HMO route, you definitely want to take a look at that. And you want to make sure that your medicines are all covered on that particular plan, because you have some that may cover diabetic insulin better. And then you may have some that may cover this particular medicine better, better, or, and so on and so forth. So those are things you want to really take a look at before you just jump into a Medicare Advantage plan. So if this video you felt has helped you, enlightened you a little bit, educated you when it comes to whether a Medicare Advantage Part C plan can be right for you, then please click on the like button. Throw us a comment and let us know if there's another question that you may have that we didn't answer in this video today. And maybe share this with someone that you think needs to hear this. Maybe they're on a plan right now and they're confused, or maybe they're new to Medicare or getting ready to go on Medicare, and they need some help in figuring out what's the best option for them. And then finally, make sure to turn on the notifications, subscribe and turn on the notifications, because we're going to be dropping fresh content like this periodically, where we're talking about different type of plans and different type of prescription plans and other ancillary plans that will work with your Medicare, dental and vision, cancer, the importance of having those type of plans in place. And so you don't want to miss out when we drop content like this. All right, God bless you guys. Make it an awesome day.